What is commonly recognized as ADHD is merely a cluster of symptoms because nobody else had a good idea of what the disorder was due to. The symptoms are difficulty with concentration, distractibility, impulsivity, and if you're overactive or hyperactive, then you're called ADHD. It's just an additional cluster of symptoms to ADD. You don't get lost with a whole bunch of initials and terms. It was thought for many, many years, especially recently, that the thinking brain is impaired in ADHD. This is the frontal lobe of the thinking brain, and it is impaired. But gifted people have it. CEOs of major companies are now coming out and saying, I had ADHD, it helped me, or I got by despite it. Well, they're gifted, they're bright, and all they have when you examine them carefully are balance and coordination signs. Difficulty walking straight with their eyes closed. In fact, they'll flunk a DWI test. And they could be athletes, but with their eyes closed, the inner ear isn't working, and the cerebellum, which is the computer for the inner ear, isn't working. And what I had discovered years before is that this cerebellum and inner ear, the lower brain of man, sends signals all throughout the brain, and the thinking brain up here interprets these signals. However, when there's a problem within the inner ear, you don't have just balance and coordination problems, but you have sequencing problems. The signals coming into the sensory part of the brain are scrambled. And it's like a TV set. You're watching a scrambled TV picture, or the sound is scrambled. And depending on the degree of scrambling, you don't know what's going on. So the brain seems to be impaired, but it's secondarily impaired, because if the signals are cleared up, the brain functions normal, which is perfectly sensible, because how can you have gifted and brilliant people with ADHD and dyslexia if their thinking brain was severely impaired enough to give you major symptoms to flunk them out of school? This is not well recognized, but the advantage of understanding this is multifold. One, I discovered many years ago that by treating the signal scrambling, by straightening out the signals, you can get vast and dramatic improvements in concentration, distractibility, and activity, even without the stimulants. If you add the stimulants when necessary, you need much lower doses, and you get much more dramatic effects. Not only that, when you add simple inner ear improving medications that improve the signals, then all the learning disabled symptoms, the dyslexia, the difficulty with reading and writing and spelling that invariably occur in people with ADHD also improve. Now, people are medically treating the ADHD and only educationally treating the learning disabilities. And this doesn't make any sense. It's now possible to treat the whole thing medically, and of course the whole thing educationally as well, to get the best possible results.